Needless to say, here I am. I'm still upbeat. I am concerned but not overly scared. My father, who resides in the UK, he has had bladder cancer for the last 8 years. He has had 8 cystoscopies where they've removed growths, and he's still going reasonably strong, even though he is 88 years old. So there is hope, and I'm not panicking yet, but we will see where the procedure takes me, and hopefully I come through it on the other side cancer free.
Coming home was good to get out of hospital. It was a hard first 6 or 8 weeks at home, but with the help of family you can get through it. It's now probably coming up 3 months since I've been home, and it's been worth the fight. The Neo bladder is as good as I can expect at this stage. It's probably 95% during the daytime continence. Nighttime started the first week or so quite badly, but it has become probably 90% continence at night. I have to get up 3 to 4 times a night to empty my bladder, but being an older bloke, you're up that many times anyway, and I wouldn't make that a deterrent if you're going to think of the Neo bladder. You've just got to remember to go a little bit more often, and if you don't go, your body will soon tell you that you should be going. I have to have CT scans every 3 months for a year, followed by CT scans for every 6 months for a year after that, and I think yearly up till 5 years, and regular blood tests. Financially, it's been a little bit tough. It's been 8 months now without work. I'm an electrician, and I could go back to work, but really if you're in a manual type job, you want to give yourself at least 6 months after surgery before you're thinking about going back to work.
After discussing initially with the Neo bladder versus the urostomy bag, or that the stoma feeds into, I followed my urologist's advice for me as a male, 57 years old, and went with colloquially what's called a bag, and it has been a big adjustment. I've had a few accidents along the way, and you feel as though you're wetting yourself and things like that, and there's new routines that I have to adhere to. I suppose one huge advantage, even though there's lots of disadvantages, the huge advantage is that I can sleep through the night. And that was one of the reasons why I decided to go with the bag rather than with a Neo bladder inside me, was the idea of being able to sleep through the night, which is the big advantage. But the disadvantages are that sometimes the bags leak, sometimes they're uncomfortable, sometimes I forget to empty the bag, and then all of a sudden I think, oh no, bag's full, I've got to empty my... So it's funny things like that. I'm a bit self-conscious that it shows up through my clothing. My bag does prevent me from doing some really active stuff. Being a car salesman, it doesn't slow me down there, but I also volunteer for the SES, and so it means they've had to find another role for me within the SES, because I can't go clambering onto roofs or be strapping into harnesses or be swimming through a raging torrent to rescue somebody. And I suppose the biggest adjustment for me is my physical relationship with Leslie. It's changed the whole way we do the sex thing, and so that's been a big adjustment, and we're still working through that.
At the moment, so it's 3 months on, and we're feeling really positive. I'm feeling fairly much that I'm getting my life back, and that Steve is, and that we're getting back to normal. Steve's got his energy levels up 85% or more. He's able to think clearly. He's doing pretty much what he was doing. He had some lung complications unforeseen in his surgery, and it's not making too much difference at all. Yes, we've had to adjust, like in our personal relationship, physical relationship, because we didn't actually realise, well, I didn't really realise too much at the time that sexually and all of those things would impact more. And we sort of think, oh yes, we'll manage, we're close, intimacy and things, well, that we'll work around that. But it has been an adjustment to adjust to that, work out intimacy things in a different way. And for a guy, it's particularly hard. And yes, I miss that, but I said, darling, you're still the same person. Yeah, sure, you've got a bag now, but as a nurse, I mean, it didn't really worry me anyway. And he sort of does it all. First off, when he came out of hospital, he needed me to do a lot for him, and he was very tired, could hardly do anything. Within a week, he turned the corner, and things started to just pick up. We've had initial follow-ups, and we've got a 6-month thing coming up in February where we have to do another round of scans and things, but we're not too anxious about it. And yeah, we're enjoying life. So.